I don't think any parent thinks they're going to have a sick child. So when she was born, she was small, which was shocking. The next day, she started showing symptoms. Her Billy level just kept going up. 9 days later, she was released. And they said, you're gonna have to bring her back. We need to run more tests.
There were a lot of visits to the hospital, a lot of visits to the ER. You know, definitely, one of the main things is a normal person's Billy is supposed to be in like 0.1, 0.2 and stuff like that. Hers always in the double digits for pretty much almost her whole life.
The first day I met Kayla, I was at the bedside, and they asked me if she could be a patient with another liver disease, which is much more frequent. We call that biliary atresia, because she had some jaundice.
They said, well, good news, it's not biliary atresia. I said, okay. They said, we still don't know what it is yet, but it's not that.
I said to the student, the resident, even the junior attending doctor, I say, that's not the biliary atresia. And they asked me why. I said, because she has some features of Alagille syndrome.
Alagille syndrome is a genetic disorder, and it affects multiple organs. Within the liver, there's decreased number of bile ducts, so there's paucity of bile ducts. Patients usually present at a young age with jaundice, and they have accumulation of bilirubin because the bile cannot leave the liver into the intestine the way it's meant to.
I would get people coming up to me and saying, why is her eyes yellow? And, I have to explain something that I barely understood.
Kayla's jaundice never resolved, and with time it actually got worse and worse. She had significant complications of liver disease and Alagille. So she had malabsorption, she had significant vitamin deficiency that you can see with this disease. She had severe itching, and I think this is what finally told the parents, you know what, she can't live like this.
Her itching just kind of exploded on us, and Dad works nights, and I'm a teacher, so I'm getting up at 6:30 in the morning, and she would wake up screaming.
She would wake up in the morning sometimes, and her bed was covered in blood because of all the itching that she did during the night.
She would scratch so hard you could be sleeping and you would wake up because it's like nails on a board, how hard she would dig.
It's heartbreaking to know that as a parent, you can only do but so much. At some point, it's almost out of your hands.
She attended the school that I worked at, so she would be falling asleep in class. Her teachers would knock at my door and say, Kayla's asleep, we can't wake her up. And I was like, oh, okay.
We definitely exhausted the option of drugs. Like, there was no other drug you can possibly give.
At the same time, we noticed that with time, her liver had more and more fibrosis. Her liver became very hard to touch, so we knew that she had significant scar tissue as well.
We knew that this was it. It was coming. We got the letter in the mail about her being on the transplant list first.
We knew that Brian, her father, had the same blood type, and from very beginning, he was the one who came forward and said, I would like to be the donor for Kayla if it's at all possible.
We wanted to be in control of the surgery. We wanted to be in control of it. And we knew that with a living donor, that's exactly what we would be able to get. We could schedule our date, we could get our affairs in order.
To me, this was no doubts about it. She needs it, whatever she wants, whatever she needs, she can have it. So, to me, it's just being a parent. These are our kids, these are our futures. To me, there's nothing I wouldn't do for mine. So, I definitely. But the night before the surgery, yeah, I didn't sleep a wink.
In this case, where we did a living donor liver transplantation, then, it needs a big team of surgeons also in the OR for that. So there's usually 2 surgeons doing the surgery for the donor, as well as 2 surgeons doing the surgery in the recipient. So it's a big mobilization of the entire team for that.
It went off without a hitch. It was, to me, it felt like as fast as I closed my eyes, they were done.
She woke up very soon after surgery. The liver was working right away. All the parameters, her physical parameters, laboratory parameters, were improving.
After it was all said and done, you know, I just wanted to make sure she was okay, so every chance I got, went over to see her and spend time with her, so.
Only a few days after his transplant, Brian was at Kayla's bedside. He stayed with her, he took care of her, he spent nights with her in the hospital until she was able to go home.
I definitely wanted to make sure that, you know, she knew that I was still here for her. It wasn't, okay, Daddy then gave me a piece of his liver and now he's done. No, Daddy's still here for me all day, every day.
And to see him there in pain, just trying to get up, just trying to come across the hospital, I would wheel him over to her. It was an eye-opening experience to let me know that he loves his daughter so much that he would give her, you know, part of his liver. Without second blinking, it was like, wow.
It's amazing to take a child who is sick, a child who is yellow, a child who is not growing, a child who's not feeling well, and after the transplant, you see that they blossom.
She's been, you know, wonderful throughout the whole time, and then we see her today, and then back with her iPad and playing and smiling, and then for us, it's the best gift.
As you can see, she looks great. If you saw her on the street, you wouldn't know that this is a patient who had a transplant about 6 weeks ago.
To know that my child is here because she had a transplant done, I can't be so, it's beyond words.
It's a really exciting future ahead of us, and one of the limitations to the future is funding for these researchers. This is one of the things the American Liver Foundation has been in the forefront of. I received support from them, fellows who've trained with me received support from them, helping us to do research and showing us the way to a career in research.
The clear progress we made over the last 20 years was to say, now we know transplant is a routine, it's not experimental. Transplant works.
Kayla, it was worth it though, right? It was all worth it. High five. That's right, yeah.